I wasn't actually thinking that I was going to be a doctor, but during the time that I was in college, people were going into the financial industry, and it started to look to me like a lot of those job options were a little bit empty and didn't have a lot in terms of real meaning for community. And my dad was an internist, and I felt like being a physician allowed you to be a part of your community in a way that really fit my values. The things that I like about my job are that I get to be a part of people's lives in a way that's meaningful, and sometimes that's with helping them to feel better when they're sick, and sometimes it's with being an ear for them in telling me something that they maybe can't tell anyone else in their life. And oftentimes I can do something to help them feel better for whatever the issue may be, and that's a pretty special role, and one that I'm very privileged to have. Well, one of the great things about being part of CPMG is that I get to work with people in the next office, and I get to work with people across town. And so I feel like I have a really expansive set of colleagues and peers. And in some ways it's almost like having the best of an academic practice, because I get to get all of these experts' advice in these really wonderful curbside consults, and I get to learn from them without necessarily having to send my patients off. And so I really enjoy being able to interact with our specialists and with my other primary care colleagues, both in my clinic and the ones that I get to meet through being a local chief. I have an amazing chief group that I work with in internal medicine, and they all really bring so much to the table. I love the people I work with. What gives me pleasure? I'm a Boulder girl, and so a lot of what's important to me involves the opportunity to be outside. And obviously we have a lot of wonderful mountains and playgrounds, and so I like to ride my bike, and I like to spend time with my kids, and the things that probably make all of us happy are the things that I most enjoy. I've had a good day when I feel like I've made a difference in patients' lives. It always helps to have an interesting diagnosis or something that's intellectually stimulating. Having good interactions with the staff and my colleagues, and getting home at the end of the day with something left over so that I can really engage with my husband and my kids and feel like I can be present for them.